All right, good afternoon, everyone. I am Marissa with New Lenox Fire. Thank you for coming to our TRIAD meeting today. Today we have Loretto, who is going to she has a lot of information about Medicare that she is going to be sharing with us. And with that, I'm going to go ahead and I'm going to start sharing the presentation so she can start letting us know everything that there is to know. Let's see. Go.
Good afternoon. It won't be quite everything there is to know about Medicare because that's a pretty long list, but this is some of the most important information at this time of year, an update for next year. As you know, you can go to the next slide, please. As you know, we're in the open enrollment period that occurs every year at this time. It started on October 15th and runs until December 7th. This is your annual opportunity to review your current Medicare drug plan or Medicare Advantage plan. You can either decide to stay with what you have, switch to a different drug plan, switch to a different Medicare Advantage plan, leave Medicare Advantage and go back to traditional Medicare, or leave your drug plan and do without entirely. So you have a lot of options. We urge everyone to evaluate their current coverage and never to assume that your current plan, either a drug plan or a Medicare Advantage plan, is your best choice for next year. It might be, but it might not. And there could be a lot riding on that decision. So don't assume and don't procrastinate. Now, this annual enrollment period is for people who are already in Medicare, not for new enrollees. They have a different timetable, and we'll talk about that on some other occasion. But today, we're just talking about the annual enrollment period. Next slide, please. Let's do drug plans first. There are 31 different drug plans to be offered in Illinois next year, 28 this year, so we have 3 new ones. And the premiums range from $7.30 up to $147.80 a month, an enormous range. But of all of those 31 plans, there is no one best plan. It all depends on what drugs you take. The maximum deductible next year will be $445, a $10 increase from this year. But many plans don't apply the deductible to generic drugs. They waive it for all of them, or at least for tier 1, which are preferred generics. So that affects the equation also. You should already have received an annual notice of change from your current drug plan. That should have gone out in early October or even late September. And that gives you basic information about that plan for next year, but not about all the others, of course. Every year, the plans can change their premium, their deductible, their formulary, that is the list of drugs that they cover, whether they require any usage restrictions, which can be quantity limits or requirements for prior authorization or step therapy. They can change the list of pharmacies that are preferred or non-preferred or entirely out of network. And your list of drugs that you take may have changed since this time last year. So with all those variables, it's a very complicated equation. We always say, if you try to do the calculation for yourself of the best drug plan, there isn't enough scratch paper in the world to do that, even if you had all the information. And you don't have all the information. So the only way to do it is with the Plan Finder. Next slide, please. The Plan Finder is the tool on the Medicare website that is the only objective source of information on all the plans, on all the drugs for next year. When you enter the list of your drugs that you take, the Plan Finder will do the calculation and identify the plan that will cover them at the lowest total cost. And then it gives you a lot more detail if you're interested. Not only the total, which is the sum of the premium times 12 plus all your co-payments throughout the year. It will tell you what it will cost month by month, what it will cost for each individual drug, whether there are any usage restrictions, and which pharmacies are preferred or standard but non-preferred in that plan. Then once you've identified the plan that's your best choice for next year, you can enroll through the plan finder on the Medicare website directly, or you can call Medicare and ask them to do it, or you can call the plan directly. You'll end up either way. Any one of those three ways will all work. Using the plan finder does not commit you to anything. It just gets you a cost estimate. Then you have to actually enroll. Next slide, please. So how do you do it? Go to Medicare.gov and right on the home page, you click on Find 2021 Health and Drug Plans. Health plans, by the way, refers to Medicare Advantage plans. If you already have what's called a My Medicare account, you can enter your username and password, and it will give you a list of all the prescriptions you had filled this year, some of which may be things you're taking continuously, others may be ones you took for a short period. You can delete those from the list. That will give you a head start. If you don't have a My Medicare account, you can begin one online, or you can just enter the list of drugs yourself directly. All of these ways work. So you compile the list and enter it, including the name of the drug, the dosage, and the frequency, such as lisinopril, 20 milligrams once a day. Similar information for every drug you take. If you take a name brand, list the name brand. If you take a generic, list that, because that can make a huge difference. You also can identify up to 5 different pharmacies or 4 pharmacies and mail order, and that will give you the prices at all of those options. Then the plan finder will give you the plans in ascending order of total price. In other words, the one that's listed first is the least expensive choice, and it provides a lot of other information as well. Next slide. So then, how do you enroll? If the plan finder tells you that the plan you're in this year is your best choice for next year, you don't have to do anything. You will automatically be re-enrolled for 2021. But if you want to switch or enroll for the first time, call the plan, the phone number is given in the plan finder, or call 1-800-MEDICARE, or enroll on the plan's website. Now, some of the plans have similar names and it can be very confusing. So pay close attention and be sure you've got the name correctly. Plans also have a number, and it wouldn't hurt to use that too, so that you're sure you've got exactly what you chose. One of the things you'll need to decide is how you want to pay the premium. You can either send the plan a check every month, and if you choose that option, they will give you a book of coupons and you tear one off and enclose it with your check. Or you can authorize the Social Security Administration to withhold the amount of the premium from your monthly benefit and pay it directly to the plan. Or you can authorize your bank to pay it automatically. It's your choice. Ordinarily, enrollment in a Medicare Advantage plan or a drug plan is for a full year. There are some situations in which you get a special enrollment period, but usually it's for a full year. Next slide, please. The extra help, also known as the low-income subsidy, is a federal benefit that is offered to people with limited income and assets. The current income limit is $19,140 for a single person, or $26,160 for a couple. There is also an asset limit. This does not include the value of your home, your car, your personal property, and household goods. What they're interested in is liquid assets such as bank accounts, stocks, bonds, certificates of deposit, that kind of thing. And that limit is $13,110 for a single person, $26,160 for a couple. Both of those, the income and the asset limits, are likely to be raised a little bit next year. It's based on the poverty level, and that will be recalculated, and probably in February we'll have a small increase, 1 or 2%, something like that. You apply for extra help through the Social Security Administration, and you can do it online. In fact, that's the easiest way to do it now that Social Security offices are closed to the public. Of the 31 drug plans in Illinois next year, 10 of them will have no premium for people receiving extra help. It won't cost you anything to belong to the plan. And all of the plans have low copayments for extra help recipients. And extra help recipients also get an extra little perk, and that is that they can switch plans up to 3 times during the course of the year. Most other people are in it for a year, but extra help recipients get a little extra flexibility. Next slide is Medicare Advantage plans. These are what are also known as health plans. Medicare Advantage offers an alternative of managed care instead of traditional Medicare A and B. If you're in Medicare Advantage, you are still in Medicare. You still pay that same Part B premium, which is currently $144.60 a month. Then you have the option of joining a Medicare Advantage plans that serves where you live. Medicare Advantage plans contract with Medicare to serve specific geographic areas. So for instance, a plan might contract that they would serve Cook County, DuPage County, and Will County. So if you live in any one of those 3 counties, you can join that plan. I, who live in Kankakee County, cannot join that plan. I don't live in the service area. So it all depends on where you live. One of the handouts that I provided today is a list of all the Medicare Advantage plans that are available in Will County for next year, and there are 49 such plans. Medicare Advantage plans have to offer all the standard benefits of traditional Medicare, and they may offer extra goodies. Some of those extras most commonly offered are vision or dental care or membership in a health club. However, I frequently get phone calls from people who say, I want that plan that I saw advertised on TV that has comprehensive dental and vision care. Well, it's usually not quite that generous. They don't lie in the ad, but it's the nature of advertising to make whatever it is being promoted sound fabulous. And usually there are some restrictions. It might, for instance, be that a plan will cover dental care at a particular dental clinic, but you couldn't go to your dentist that you've been seeing for years. Or maybe it covers up to a certain dollar amount of care per year. And if you need more than that, that's your expense. So that's better than you'd get from traditional Medicare, but it's not quite what the ad may have led you to think. The basic information about Medicare Advantage plans in your area is offered on the Plan Finder, a little expansion of what's on that list I gave you, but you will need to do some further research because this is a complicated decision. Next slide, please. The 2 main kinds of Medicare Advantage plans are health maintenance organizations, HMOs, and preferred provider organizations, PPOs. HMOs have networks of providers, including doctors and hospitals and physical therapy agencies and all kinds of other providers. In an emergency, you can certainly go to whatever hospital is closest, but for non-emergency care, you have to use providers in that plan's network. If you go to somebody else, the plan does not have to pay anything towards it. HMO point of service gives you a little more flexibility to see out-of-network care costs, but it will cost more to you than it would if you saw an in-network provider. HMOs usually require that you have a referral from your primary care physician before you can see a specialist, and they may require prior authorization for some care. So there are some restrictions. PPOs, the next slide, are a little more flexible than HMOs. As the name implies, some providers are preferred, but they will pay something for a non-preferred provider. They also usually don't require a referral to see a specialist. So you've got a little more discretion in a PPO than in an HMO. One of the most important things you should consider before you join any HMO or PPO is who is in the network or who is preferred. For example, if I go to Dr. Smith and I want to continue to see Dr. Smith, that should be one of my first questions. Is Dr. Smith in the network or is he preferred in this plan? Furthermore, if I see Dr. Smith for my primary care, but I also see Dr. Jones, a specialist, Now I need a plan that has both Dr. Smith and Dr. Jones in the network or preferred. That's the ideal. So the more specialists you see, the more complicated it can be to find a plan that includes everybody. So review that carefully. You don't want to find out too late that you have locked yourself into a plan in which you can't see the doctors that you prefer. Next slide. One of the big advantages of Medicare Advantage is that it has limits on your out-of-pocket costs, the total amount that you would have to pay for Part A and Part B services. There is no similar limit for traditional Medicare. The sky is the limit for that. For instance, we hear horrible stories of people now who have COVID and who are in the hospital for weeks and weeks, including weeks in the intensive care unit. You can imagine what their costs will be. But if they're in a Medicare Advantage plan, the annual limit, provided they are getting care in network or from a preferred provider, that annual limit will curtail that. And that is noted on the handout as well. When you're choosing one of these plans, your crystal ball is a little cloudy. You don't know what healthcare conditions or problems you are likely to experience in the coming year. But you do your best to plan carefully for what you are likely to need and then consider the possibility that there may be some unforeseen needs too. And what is that likely to cost you? It's a difficult calculation, but it's the best that we can do. Most Medicare Advantage plans include prescription drug coverage, but not all. And if you're in a plan that doesn't include prescription coverage, then you can join a standalone drug plan. Next slide. Medigap supplemental benefits are an option for people who are in traditional Medicare. We just said that in Medicare Advantage, there's that annual limit on your total out-of-pocket expense. Because there is no comparable limit for traditional Medicare, you may want to get a Medigap or supplemental policy. These are offered by many private companies, and they are regulated by Illinois state law as well as by federal laws. Medigap policies are standardized. They are labeled A, B, C, and so on. Every A policy from one company is identical to an A policy from another company. In other words, an A from Blue Cross is exactly the same as an A from Aetna, or an A from Humana, or an A from United Healthcare, or any other company. Everybody's B is exactly the same, and so on. But the prices are by no means the same. They can vary widely from one insurer to another. A very important protection for someone who has Medicare supplemental insurance is that a Medigap policy cannot be canceled. As long as you keep paying the premium, they cannot throw you out of the system. Furthermore, you cannot be singled out for a rate increase. The company cannot say, oh, you've been hospitalized 4 times and you've had surgery and you're developing some very expensive healthcare conditions. We are losing money. We have to say goodbye. They cannot do that. They can raise the rates for everybody in an age group, but they cannot single out an individual policy holder. So that's a very important protection. Next slide. This turned out smaller than I had hoped, so I hope you're able to read it. You may have to print this page individually. This shows the benefits that are covered by the standard plans, A, B, C, and so on. And there's a lot of detail about this in the Guide to Medigap Insurance that's put out by the Illinois Department on Aging. Next slide. In the first 6 months that you are in Medicare, usually the month of your 65th birthday, you have what is called guaranteed issue for Medigap, which means that no matter what company you choose and what policy you choose, they cannot turn you down. Again, they can't say, sorry, you've got 6 expensive conditions and you've been hospitalized 4 times in the last year. We don't want you. They have to take you. After that 6 months, they may take you, but they don't have to, or they can require medical underwriting. So we urge everybody, if you're going to get Medigap insurance, get it at the outset and choose for the long haul. Don't choose something that you can just barely afford because you know prices are going to go up. So choose something that you will be able to live with indefinitely. There's no waiting for coverage of a pre-existing condition when you enroll in a Medigap policy if you had had comprehensive insurance right before you enrolled in that plan. Otherwise, the plan can impose a waiting period for no more than 6 months, but Medicare will cover that condition, such as diabetes, from the outset. New enrollees after the first of this year, 10 months ago, cannot buy a C or an F policy, but they can buy a D or a G. And the only difference between C and D, or between F and G, is that C and F cover the Part B deductible, which is currently $198, and D and G do not. But if you look at the premiums, frequently the difference between C and D, or between F and G, is more than $198. In other words, D and G are frequently a better buy. That will make more sense when you look at sample premiums. And those sample premiums are all listed in this book that's on this slide. It's put out by the Illinois Senior Health Insurance Program, which is a division of the Department on Aging, and it's called the Medicare Supplement Premium Comparison Guide for 2020-2021. In Will County, you should look at the Chicago edition, which includes the suburban counties. The first half of that report explains what all the different policies cover, and it explains your protections such as guaranteed issue and no cancellation of policies. And then the second half gives you sample rates for every company that sells Medigap insurance in the state. So it's an invaluable resource to have. Next slide. This slide is a disappointment, and I wish I were able to give you the answers to these blanks. We don't have the information yet. The Part A premium for next year hasn't been announced, the Part B premium, and so on. We're still waiting. I kept this open until about 4 o'clock yesterday in hopes that we'd get the information. We don't have it. The Part A premium, most people do not pay because they earned premium-free Part A by paying the payroll tax during their working lifetimes. The Part B premium this year is $144.60. That, for most people, is withheld from your Social Security. If you're not yet on Social Security, they will bill you for it quarterly. The Part A deductible is currently $1,408, but this is not an annual figure. This is per benefit period. A benefit period is a little tricky. It begins on the day you are admitted to the hospital as an inpatient, not going to the hospital just for a test and then you go home a couple of hours later. But if you are admitted, you owe the Part A deductible of $1,408 this year. And that benefit period lasts until you have been discharged from the hospital. It also extends on a stay in a skilled nursing facility, which is a Part A benefit, and lasts then after you leave the skilled nursing facility for 60 days at home. If after 60 days at home, you then are readmitted to the hospital, either for the same condition as the first time or for something unrelated to it, you're in a new benefit period and you pay the deductible again. It's mathematically possible to have up to 5 benefit periods in the course of a year. You really have to work at it, but it is conceivable. On the other hand, you could be in and out of the hospital many times during the course of the year. And if you were never home for 60 days between one and the next stay in the hospital, you'd still be in the same benefit period. You would only pay that deductible a single time. So timing is everything. The Part B deductible is currently $198. After you have met the deductible, in most cases, you then pay 20% of Medicare's assigned rate for the various Part B services that you receive, and Medicare pays 80%. There are a few exceptions to that rule, including preventive benefits, but that's the general rule. If you have a high income, which is defined as over $85,000 for a single person or $170,000 for a couple, then you pay a higher Part B premium and also a higher Part D premium. And as we noted earlier, the premiums for Part D drug plans and for Medicare Advantage plans vary widely. So we're not able to give a single figure for that. So watch the newspaper in the next couple of days. They're going to announce these figures soon, I certainly hope. And I'm sorry we don't have them now. Next slide. Preventive benefits. As I mentioned, most Part B services are subject to the Part B list of assigned rates and the 20% copayment. But there are a few that were added to Medicare under the Affordable Care Act, and they are free to Medicare recipients. In other words, they are not subject to the Part B deductible nor to Part B copayments. The most timely one at this season of the year is the flu shot. You see ads for flu shot clinics and urging people to get flu shots because of all the misery and medical risk that can avoid. And it's even more important now during the COVID pandemic. There's also the pneumonia vaccine, which you need 2 times a year apart. Both of those are covered in full by Part B preventive benefits. There's no copayment at all. There are many diagnostic tests, including tests for cancer and heart disease and osteoporosis and other conditions. There's a lot of information and detail about this in your annual book, Medicare and You. Everybody should have received this book, Medicare and You, and all that information is in there. During the COVID during the COVID pandemic, it's especially important that we use all these resources to guard our health while we're trying to stave off the vaccine and the virus. Don't succumb to something else and take advantage of the preventive benefits that are available to you. I have no medical qualifications at all. Talk to your doctor about what preventive and wellness benefits he or she would recommend for you individually, and then follow up on that advice. Next slide. Speaking of COVID, there have been a few changes, or really adaptations or clarifications in Medicare. The test for COVID itself and for antibodies for people who have had it are covered under Part B, and there is no copayment for those tests. If you are hospitalized with COVID, it's subject to the Part A cost structure, including that Part A deductible of $1,408, just the same as if you were hospitalized for any other condition. The Medicare provisions for telehealth have previously been pretty restrictive. I think of it as the benefit that people in Montana use where they live 150 miles from the hospital. And a telehealth call frequently is sufficient and saves time and money and is highly desirable. Now, when we're trying to limit people's exposure to the virus, telehealth can be a good way to do that. So they've relaxed the rules considerably. If you have a doctor's appointment where you think this might be feasible, check with your doctor and see whether that is a good alternative. When we get a vaccine for COVID, it will be covered by Medicare Part B. Not all vaccines are Part B, but that one will be. Drug plan enrollees are encouraged to get refills early. Don't wait until you only have a 1 or 2 day supply on hand to order a refill of your prescriptions, both because we don't want you having to go to the pharmacy when it could be avoided, and we don't want to encounter gaps in supplies. That is not proven to be as serious a problem as we anticipated might develop, but it still can happen. Sometimes the pharmacy doesn't have the drug that you need. So again, don't wait until the last minute and get as large a supply as is medically advisable. They have also relaxed some of the rules on prior authorization, which both Medicare Advantage and drug plans can impose. So again, that makes it easier to stay on top of things and keeping up with your healthcare regimen. The next slide is about fraud in Medicare. This is a chronic problem because Medicare is an irresistible target to thieves of all kinds. There is so much money involved in Medicare, billions and billions of dollars. And so con artists just can't resist the temptation. But it's even a greater problem now because of COVID. Con artists prey on seniors because of their isolation and their anxiety and their uncertainty. And that all those conditions make people very vulnerable. So guard your Medicare card number. Don't give it to anybody who calls you and says, we'd like to offer you such and such. No, no, no. If you need any medical service, your doctor will recommend it. And don't give your number to anybody who calls you on the phone, even if they say they're calling from Medicare. Medicare does not call people and ask for your number. They know what your number is because they assigned it to you a couple of years ago when we all got new Medicare cards. So don't give that number to anybody except a legitimate healthcare provider. Don't be the victim of your own politeness. Feel free to hang up on intrusive telephone calls and delete emails. These people have no business calling you. And review your Medicare summary notice. That's the document that you get periodically that lists all the services you have received in a period of time, and it tells you what the doctor billed, what Medicare's approved amount for that is, how much of that Medicare will pay, how much of it you or your supplemental insurance will pay. It's a very useful record, and it also can be useful in detecting fraud. Doctors' offices and the people who do the billing for them are not infallible. They are prone to make mistakes just like the rest of us. And so if there's an honest mistake, they will be happy to correct it. They will hasten to correct it. But if there's something on there that you think is clearly not a typographical error, raise the issue and see what the explanation is. Maybe there's a good explanation, or maybe it's that it's fraud. So if you suspect that fraud has occurred, call the Senior Medicare Patrol. That's the statewide effort to combat fraud. And there's their toll-free number, and they will be happy to look into it for you. All of this information that I've given you is just a fraction of what you should know and what you might be interested in finding out. So here are some good sources of information. Starting with the basic, here's the Medicare number, an 800 toll-free number, and a website, medicare.gov. All the Medicare publications on every aspect of the program are available on that website. You can read it online, you can print it out, you can call Medicare and ask them to send it to you. They will be happy to do so. Then there's the Social Security number, phone number, and website. Remember, Social Security handles enrollment in Medicare. They collect the Part B premium. They determine eligibility for extra help. So those are important roles. If you want to be able to help your Aunt Betty who lives in Topeka, Kansas, but you don't know where do you start in Kansas, call the Elder Care Locator at that number or website, and they will be able to give you the number of the Kansas Department on Aging and the Topeka Agency on Aging and so on. And that will give you a head start on helping Aunt Betty out. Then at the state level, here's the number and the website for the Illinois Department on Aging in Springfield, which also has an office in Chicago. And for a division of the Department on Aging, the Senior Health Insurance Program, or SHIP. SHIP is a completely objective agency that exists only to help seniors understand their Medicare benefits and use them wisely. SHIP has no affiliation with any insurance company or agent or broker. They're not trying to steer you in any particular direction. They just want to give you the information you need so you can make a good decision for your own circumstances. SHIP uses a statewide network of very well-trained volunteers. They train us at the outset and then they keep us up to date throughout the year. It's just a wonderful program. There are about 340 SHIP sites in Illinois, at least one in every county, and in some counties, many, many more. And every state has something comparable to SHIP, so this kind of information is available anywhere in the United States. And on the next slide, it lists the area agencies on aging. I work for Age Guide, that first bullet point there, and we serve the 8 collar counties, including Will County. I gave you the name and number of the Chicago Department of Family and Support Services. They are the AAA for the city of Chicago. And Age Options is the AAA for the suburbs of Cook County. And then there are 10 other AAAs in downstate Illinois. And finally, the last slide lists the 3 SHIP sites here in Will County. The Senior Services Center of Will County is in Joliet. The Disability Resource Center is also in Joliet. And the Senior Assistance Center at St. Paul's Church in Peatone is another SHIP site. You don't have to be a member of the parish to call them. They'd be happy to help you. So any one of those 3 would be glad to help you. However, at this time of year, SHIP sites are very busy. So if you want to make an appointment and get a consultation about a drug plan or a Medicare Advantage plan, call and make an appointment now. The enrollment period runs until December 7th. Don't wait until December 6th to call them, because by then they will be booked up and they will be exhausted. Call now and get yourself on the calendar, and then they will be happy to help you. So I went through that information at a pretty good clip, but what have I left you confused about? Do you have questions?
If anyone has questions, you can go ahead and unmute yourself.
Call and make an appointment now. The enrollment period runs until December 7th. Don't wait until December 6th to call them, because by then they will be booked up and they will be exhausted. Call now and get yourself on the calendar, and then they will be happy to help you. So I went through that information at a pretty good clip, but what have I left you confused about? Do you have questions? So if you think of something tomorrow, give me a call. This is a very busy season for me, and so you might just get my voicemail, but I will get back to you eventually, and certainly well before December 7th.
All right. Thank you so much for joining us today and for giving us all this useful information. We do really appreciate it. She sent me all sorts of information for everyone, so I will be emailing that out shortly. As soon as we get this recording downloaded, I will also send that out to all of our members as well. So thank you very much, and I hope everybody has a great day.
You are welcome.
Hey, thank you.
You're welcome.